Medicine in ancient Egypt. Ancient Egypt is one of the first great civilizations on the planet. The ancient Egyptians built the pyramids of Giza, the Great Sphinx, and the Library of Alexandria. They had highly developed agriculture, a robust economy, and well-organized government and judicial systems. Through trial and error, the ancient Egyptians managed to discover medical treatments, surgical practices, and medicines, many of which are still in use today. So today, let's examine the level of medicine in ancient Egypt. The ancient Egyptians practiced medicine as early as 3300 BCE. They began to develop their medical knowledge by treating battle wounds, snake bites, scorpion stings, and injuries sustained during the construction of pyramids. Despite all their medical knowledge, the average life expectancy at that time was still around 30 years. The dawn of civilization was marked by the availability of healthcare, ensuring that injuries were not synonymous with a death sentence. The lack of anesthesia and antiseptics made surgical intervention practically impossible, as it would lead to terrible pain and almost certain death from infection. Despite this, the ancient Egyptians were quite skilled in wound treatment. Using wooden splints and linen bandages, they knew how to set broken bones and correct dislocations. They knew how to sew wounds and make effective herbal ointments for treating burns. While this might sound like basic first aid to modern people, in the ancient world, even these simple treatments made the difference between life and death. Thanks to archaeologists, we know that the first truly effective surgical instruments were discovered and used in ancient Egypt. They were primarily made of copper and included variants of modern pliers, forceps, spoons, saws, hooks, and knives, which can still be found in contemporary hospitals. They also used bandages soaked in willow leaves to treat inflammations. This practice was remarkably advanced for its time. Among their many medical breakthroughs, the first prosthetics were used in ancient Egypt. A mummy of a woman who died around 950 BCE, found near Luxor, had a prosthetic toe made of leather and wood. While the idea of a cosmetic replacement for a lost toe is an impressive innovation, researchers from the University of Manchester suggest that it might have been functional and helped the woman walk. The prosthetic toe showed significant signs of wear, prompting university researchers to conduct a study testing participants' walking ability with and without the aid of a replicated toe. It turned out that walking in ancient Egyptian sandals would have been extremely difficult without the big toe. It is believed that the ancient Egyptians invented the act of male circumcision for medical reasons. What we know for sure is that the Egyptians shared their knowledge of circumcision with other cultures. They practiced it for cleanliness, considering it better to be healthy and clean than beautiful. The ancient Egyptians performed circumcision around adolescence, rather than in early childhood, as commonly practiced in other cultures. This leads to the assumption that it was a ritual marking the transition from adolescence to manhood. This practice cannot be linked to a specific social status, as not all pharaohs preserved through mummification were circumcised. In 1849, Elizabeth Blackwell became the first woman to receive a medical degree in the United States. This was quite an impressive achievement for its time, but Elizabeth actually missed the opportunity to be the first female doctor in history by about 4,700 years. The earliest known case of a female doctor is from ancient Egypt. Her name was Merit Ptah, and according to archaeologists, she lived around 2700 BCE. She likely held the position of chief physician, meaning she had the right to train and oversee other doctors, and personally cared for the health of the pharaoh. Although invasive surgery was almost unheard of in ancient Egypt, doctors still managed to accumulate quite solid knowledge about internal organs and how they functioned. The Ebers Papyrus, one of the oldest preserved documents on medical practices, illustrates their views on the workings of vital organs. Although some theories are inaccurate, others are surprisingly accurate. For example, they knew quite a lot about the heart. According to the Ebers Papyrus, from the heart, there are vessels to all four limbs, to every part of the body. For the respiratory system, they knew that when we breathe through our noses, air enters the heart and lungs, and then into the entire abdomen. Quite close. They also knew the liver, which they believed was supplied with fluid and air through four vessels. When the liver overflowed with blood, it caused many diseases. This is not exactly what you would learn in a modern medical university, but it is still impressive considering it was recorded around 1500 BCE. Even today, almost no one likes going to the dentist, But imagine having to go to a dentist in an era when dental care was not developed. The diet of an ancient Egyptian was not favorable for good dental health. The tools used for grinding food often left traces of sand and stone, which were naturally abrasive, and this often led to tooth loss at a young age. The ancient Egyptians had some remedies for these types of dental diseases, but they were quite strange and usually painful. According to the Ebers Papyrus, a mixture of onion, cumin, and incense was used to treat toothaches. This was certainly not an adequate treatment. There are cases where the ancient Egyptians filled cavities with a mixture of resin and a green mineral containing copper and drilled jawbones to drain abscesses. Interestingly, however, the process of tooth extraction, which can be life-saving in cases of infection, was rarely used. If the ancient Egyptians are known for anything, it is mummification. The mummification procedure was extremely invasive and involved dissection to remove moisture from the body. The process included removing the brain through the nose using a horrifying hooked instrument. In this case, the priests performing the sacred act had a very close view of the internal organs of the person they were preparing for the afterlife. Interestingly, the knowledge gained from mummification was not used for medical purposes. Although no one knows exactly why, these areas were so discreet that communication between priests and doctors at that time simply did not exist. This is considered a strange omission for the civilization. Although the ancient Egyptians used many real medical remedies, they still relied heavily on magic. They believed that all diseases had supernatural causes, and that healing depended on the supernatural, so medical treatment was often accompanied by a spell believed to aid recovery. One example of this is the treatment for whooping cough. The medical treatment consisted of ground-roasted mouse mixed with milk, followed by the magical swinging of a swing to drive away evil spirits. This sounds strange, but archaeologists have found evidence of the effectiveness of such treatments. Does this mean that magic works? Of course not. Most modern doctors believe that the success was likely due to a strong placebo effect. How do you think our healthcare compares to that of ancient Egypt?